Welcome back to Pulse Out of Crisis. This is the second episode of our series of conversations with leading economists in Latin America. And today we have the pleasure of talking with Nora Lustig. Nora is a professor of Latin American economics at Tulane University, and she's also the director of the Center for the Commitment to Equity Institute at the university. And she's one of the most well-known experts in Latin America about inequality and poverty. And the idea of having Nora here is to talk about the social impacts of the pandemic in the region, but also to try to think about some ways out of this crisis, particularly what's the role of social policy in trying to get the region on its feet out of this massive macroeconomic shock and social shock that the region has suffered. So, without further ado, let me, Nora, started by asking you just a first question. You have recently published a paper with Mariano Tomasi and other co-authors on the short-term and the long-term impacts of the pandemic on the social situation in Latin America. And I was quite interested on one particular issue that you stress in that paper. Is about the potential offsetting effects of social policy. Basically, what you found in the paper is that social policy has had an offsetting effect in countries like Argentina and Brazil, in a much lesser extent in Colombia, but it has almost muted effects in the case of Mexico. Can you explain us why social policy has been effective in some countries and completely ineffective and also effective in other countries, like the case of Mexico?
Yes, indeed. Well, first of all, thank you very much for the invitation, Lucio. A pleasure to be here and to discuss these such important issues for the region. Okay, so first of all, let me say one thing as a caveat, as a professor that I am, that the study that we did is based on simulations. It's not actual data. So when we don't have actual data that allows us to assess the extent of the impact of the pandemic and the offsetting policies on inequality and poverty. We have partial information. So what do economists do? As you know, is we use the tools that we have at our hand, like micro simulations, and apply to information that we have, microdata, which is household surveys that have information on households' incomes, compositions, education, etc., and you project what might be the impact on what has been happening. And in the context of the pandemic, first of all, I think we need to say, before we go into the offsetting effects, is that this we knew was going to be situation that would create lots of new inequality in the short term. And then we're going to talk about the long term, I'm sure. But in the short term, because the effect is so differentiated across sectors and also across socioeconomic strata. So you had the combination of a rising inequality with, at the same time, huge declines in total output, as we know. Latin America has been among the hardest hit regions. So that combination obviously would create lots of new poor, because even without changes in distribution, it's enough if you have a decline in average income for poverty to rise. If that is coupled with an unequalizing phenomenon like the one we probably have observed, then poverty was going to rise by a lot. And governments responded very differently across the region in terms of how to mitigate the impact on the poor. And from the 4 countries that we studied, which are the largest in Latin America, Brazil stands out for being the most, if you want, aggressive in terms of implementing policies to compensate people who lost income during the pandemic, both through expanded social assistance programs and also through direct support to salaries in firms so that the people would not be laid off. Now, you want to know why has it been able to offset so much in the case of Argentina and Brazil, less in Colombia, and almost practically zero in Mexico? money. If you allocate, first thing you need to allocate resources to the programs that have to be deployed to compensate people who lose income. Mexico has been very conservative in terms of its counter-cyclical policies at the macro level. It has not implemented, I think in the region and maybe in the world, is one of the few countries, or maybe the only country, that has not implemented counter-cyclical policies at the macroeconomic level, because it did not want to increase its fiscal deficit, in spite of the fact that all the advice came in that form, starting from the IMF itself, that has told for the first time to countries spend, spend, spend. Mexico did not. And it did not either, it didn't do it at the macro level, and it did not do it at the level of safety nets. Mm-hmm. If you read what Mexico did, in essence, it tried to sort of shift the adjustment costs to the private sector, because it, as other countries, it passed measures forbidding layoffs, and it also, sort of asked firms to provide the support that was needed to the workers, rather than implementing policies that would support firms, because it didn't do that either. It just has a relatively small loan program, and it did not increase any of its existing social assistance programs. What it did, it provided advance payments on the social pensions, but in principle, up to this point, these are not transfers, they're advance payments. I have the impression that eventually the government will say, I will continue paying you, even if I gave you the advance, I'm going to pay you anyway. So eventually they may turn into transfers. At this point, Mexico did not expand its safety nets at all, which is unusual. Mm-hmm. On the other extreme, like I said, Brazil did a very, very sort of aggressive program of compensation. It didn't start from the executive branch, because people are surprised that why is it that Bolsonaro was so worried about the poor. It actually started in Congress. It was the Congress that put a lot of pressure for these measures to be implemented. And it has a program that is called Auxilio Emergencial, that covers more than 50 million people. And what's very interesting is that at the beginning, when people were talking about what we're going to do with the informal sector, right, especially the informal sector that is not in the registries of the existing programs, like Bolsa Familia in Brazil, or the AUH in Argentina, or Familias en Acción in Colombia. So what are you going to do for the families that are neither households that have workers that are neither in the formal sector that have access to unemployment benefits, or the informal sector but have access to the cash transfer programs that already existed before the pandemic? Well, I think the pandemic showed that you are able to deploy large-scale programs reaching to those groups of people that were neither formal nor registered in the previous social assistance programs quite fast. Okay. So we learned something. Now we have to learn how to sort of make it something more, maybe more permanent, in the sense that anytime you have a shock, you're able to actually reach out to people who get affected, and see what other countries can learn from the countries that were able to do this successfully, like Brazil and Argentina. Also, both had mistakes. Both made mistakes. There are gaps. But it's huge, the amount of people that they were able to reach within a relatively short period of time.
Let me stop you there and ask you about the relationship between these social policies that you described so clearly and the health policies, particularly the lockdowns, because the countries that you analyze, even though with the limitations you were talking about, using micro simulations, doing ex-ante analysis, have completely different approaches to quarantines, particularly the case of Argentina. According to the data we have available, one of the longest and maybe one of the most strict lockdowns in Latin America, and in the other extreme, Brazil. How it has been the interplay between these strict lockdowns, at least on legal and formal terms, and the social policies that you were describing before. Because I would imagine that even though, I mean, there is some kind of offsetting effect of these social policies, when you have such a massive supply shock induced by this lockdown, by these quarantine policies, the final outcome can be quite complex to envisage or to analyze.
Yes, and I have to be. I'm always very honest with the type of work one does. We didn't calibrate differences carefully to the extent to sort of say, well, is what is happening here the result of the lockdown or because people stopped buying? I have to say the following. What research in the US shows is that a lot of the declines in output were not a result of policies that asked people to stay at home. They were self controlled reductions in demand from those who didn't want to be exposed. So even if you didn't have lockdown policies in this to the same degree, not only Brazil was liberal, Mexico has been liberal too. And remember also, the executives were liberal, but not necessarily at the subnational level. There was more strictness there. But even if you have different policies de jure, de facto, but this is something that we will need to study exposed with data. Right now is speculation that I'm saying, based primarily on what we've seen in the US. I think that the shock would have been pretty much similar because people will control themselves in terms of not being exposed to, there's certain sectors that collapsed, like restaurants, gyms, hairdressers, massage parlors, and any of the interactions that expose people to contagion. Those collapsed in countries, even if the lockdown policies were laxer. So I think that the interaction, maybe we'll see in the future that some of the lockdown policies were redundant, and maybe it would have been better to let people decide. I'm not sure, or maybe the opposite, because you have a trade-off. In some cases, the impact on health might have been harder if you didn't have the lockdown. But we don't have enough data for now to say with certainty. So I am just giving you some conjectures.
Okay, let me move you to a second issue, which is also covered in your paper, which is related to the long-term impacts. And particularly one thing that it struck me as something extremely interesting, you speculate and you analyze there, is the impacts of school close downs or closures on human capital accumulation and particularly on the long-term income of children. So if you can comment on that, because one thing that we've seen that is a quite important difference between Latin America and, for instance, Europe, that now Europe seems to be going through a second wave in the virus, but they have maintained the schools open. And in Latin America, there has been a quite strong resistance for many governments of reopening schools and, in general, the educational system.
Yes. Okay. So yeah, thank you for that question. It's very important. Like I said, to sum up, the short-term effects were very large, but some countries have been able to cushion them. And the cushioning depended on the amount of resources and the effectiveness with which you were able to distribute them to those who were losing income as a result of the pandemic. But there's one impact in particular that people have been paying less attention to, which is they have focused on school closures, but less so on what does it mean for long-term social mobility and equality of opportunity. And what we did in the paper is to sort of build counterfactuals with data that you have that exists, that has educational levels that are also in for people for which you have also the educational levels of their parents. And we were able to sort of simulate, if you want, the impact of not being able to complete the year because of school closures on the ability to complete high school by cohort. And by cohort, and very importantly, by family background.
Mm-hmm.
What we did is to see to what extent the fact that you have a very differentiated ability of households to replace schooling by homeschooling can lead lasting effects in educational gaps.
Mm-hmm.
And what we found is that for children who are born to parents that have less than high school, the ability to complete high school themselves has been lowered. And in some cases, it has been lowered so much that you're back in what used to be the case for cohorts born in the 1950s and 60s.
Mm-hmm.
So the shock to education for children of disadvantaged households can be huge. And this shock can have lasting effects in terms of social mobility, inequality of opportunity, and also inequality of outcomes. Because what it means is that you're going to have less people with skills coming to the labor force, or again, wages of the skilled may be rising faster than wages of the low skilled, and that generates earnings inequality, which was something that happened in the region in the 1990s.
Mm-hmm.
And so we're in a situation in which, if this is not taken care of, we are going to face consequences that are going to be quite hurtful for a region that had been making progress. Now, is the solution not closing schools? I don't know. I'm not an expert on that. What I do know is that if you can't keep schools open, then you have to find a way to replace the conditions for the group of people, of children who are in disadvantaged families, so that they do not fall behind to the extent that we are seeing now. So you will need to be imaginative in terms of having alternatives that can continue if you want schooling for children who do not have maybe access to internet, who do not have parents who can mentor and coach them. You must have alternatives that will help them if you continue during the period in which the schools are closed. But even if the schools reopen, you're going to have to invest a lot in catching up. So, very importantly, governments in the next few years, as they face, which they will, they need to rein in fiscal deficits, because after this expansion, the things will have to be put back into balanced equilibrium in terms of the budget. As they face that, they should really protect education spending, and maybe they should even think about how they will be able to increase education spending for targeted programs.
Nora, let me stop you there. We are running out of time. We're coming to the end of the interview. I would like to ask you more a question about the way forward. I mean, it seems that the end of the pandemic seems to be on site with these discoveries of quite effective vaccines. And most likely, sometime maybe sometime of next year, the pandemic is going to abate, hopefully here in Latin America as well. What do you think is going to be the role of social policy of getting the region on track, particularly given this dire scenario you are painting, both on the short term, but also on the long term impacts of the pandemic?
Well, I think that there's three items that we need to think about. We see that we are facing recurrent systemic shocks in the region, and that you need to have ways to compensate people that may not be in the system regularly because they get losses in income that are not necessarily happening traditionally. So they're not going to be they're not in the formal sector, and they're not in the registries of the social assistance program. So I would urge everybody to look into how can you deploy assistance, social assistance, quickly if another shock occurs. Rather than thinking of universal basic income, which is what a lot of people are advocating, I would think about how do you make the right to a basic income possible through systems that deploy fast help when needed. Because otherwise, you're going to be spending money on people who don't need it if you have a universal basic income in general. So that would be one recommendation. The second one is the one that has to do with education, which I already said. Be careful in terms of how you budget for education, and be very mindful of introducing programs that allow the catching up of the children that fell behind, if you want to really have more equitable societies in the future. And thirdly, one thing that's going to happen also is as you try to reinstate fiscal balance, you're going to have to raise taxes. Be careful how you raise them, because if you start raising them through certain type of taxes, you may end up hurting the poor or the middle sectors that became poor as a result of the current shock. So how you design the tax system in the future has to have, if you want, the social equity objectives in mind as well.
Excellent. Thank you very much. It was an excellent response to a very complex question. And also, as you mentioned, I think the region is facing a very complicated way out of this crisis with long-term impact. So I think, as you said, there are responses that has to be well thought, well designed, both on the fiscal policy, but also on the social policy front. So thank you very much, Nora, for this extremely interesting interview. It has been a pleasure talking to you. It has been full of insights about the impacts about this pandemic in Latin America, the things that we know, the things that we don't know. But for sure, you gave us a lot of food for thought in terms of the way out of this pandemic for Latin America. So thank you very much in the name of all of us, and particularly me. And again, thanks.
Thank you, Lucio. It's been a pleasure.